Thank you very
Any
much, Mr.
questions?
Sloan.
Yeah.
Any
you.
questions? All right. Thank you. Good afternoon.
Good afternoon. My name is Tom Randa, and I am the Executive Director at the Good Neighbor Community Center. And I'm here in support of the budget, and in particular, the Health Department, the line for the Health Department. I do also serve as a member of the board for the Board of Health. And just trying to bring to light some of the things that the Health Department is doing. And another hat that I wear is that I'm also the chair for the Cultural Centers of Lincoln. So that's what I'll be mainly highlighting, because there are so many other educated people on the board that will probably speak better about other things. But allow me to speak in regard to that. So with the Cultural Centers of Lincoln, we've had a grant that has been passed down to us by the state for so many years. It's the Minority Health Initiative Grant. Most of you are probably aware about that one, and we were here in 2019 speaking to you about the funding being taken away and the challenges that would pose to what we are doing with our community, especially those who depend on that grant. So we asked for your assistance, and the Health Department really took to their heart to make sure that this funding came back to our community. So we're actually speaking between $600,000 to $700,000 a year that was going to leave our community. But the staff members there at the Health Department put a lot of time to make sure that we got this funding back. So one of the things they did was to make sure that the executive director for the state health department came and sat with us as directors of the cultural centers, and eventually they had the community. So we organized community conversations in our community. These people who really need where the money goes to our community are the ones who got hurt. We had those community conversations, and that took a process of about 12 months, just listening to what the people in the community needed. And this was then relayed back to the state, such that this grant now just works according to what the people in the community wanted to be done. So that's a highlight of one of the things that the health department is able to do. And thinking of that, as the chair for the cultural centers, you know, working with 6 organizations it's definitely a lot of work. I don't have the time to write these grants, administer them, and then work with 6 organizations. The health department has done a wonderful job being the fiscal agent for the cultural centers of Lincoln. There are some things as cultural centers that we may not be able to have that are required of this grant, but through the health department, we are able to do the work that is obligated by those grants. Let's talk about the COVID season. That was a tough time for a lot of us. The cooperation that we got from the health department was huge. This included seeking new funding, and a big one that the city helped us apply for was the Advancing Health Literacy Grant. This was huge in educating our community about COVID-19 and what they needed to do. And then we started working on response for COVID-19. This included also organizing clinics, education clinics, vaccination clinics, addressing those barriers that are there for our community members that do not speak English proficiently. So those are some of the things that our staff members from the health department were able to come and assist us as staff members from our cultural centers to be able to do. Let's move forward to some of the things that they're doing with the New Americans. You've heard from Brian Seck and Heather on what they're doing with our new neighbors. The health department continues to do a great job with the New Americans. I remember when I was hired in 2007 at the Good Neighbor Community Center, one of my first meetings was attending the New American Task Force meeting. And this actually happened at the health department. They provided the space for us as community leaders for mostly nonprofits. And there we were able to work and try to address the issues that the New Americans are facing here in Lincoln. We've heard about the Welcoming and Belonging Plan. Most of you have heard about that one. And what I've seen is that a lot of staff members from the health department are very involved in those meetings. They are there to give their feedback as well, and we do appreciate that. Talking of data collection about what is happening in our community, how many people are facing poverty. mapping areas where we have healthy foods and stuff like that. The health department plays a big role such that as a good neighbor center, when I'm trying to give out food, then I know where to take this food. I have 5 seconds, so I'm going to close it, but there's so many things I could talk about the health department, but I'm in support of this, and if you have any questions, I'll be definitely happy to answer those.
Thank you very much, Mr. Randa.
Thank you.
All right.